This is the Kwai River Hospital. As you can see, we arrived here on June the 18th at 2:33 p.m. And we're going to go in. I don't have any idea what's inside, but we're going to go in now. There's Ruth and Paul's future father-in-law right there. This is the signpost out on the road telling about the hospital, what it is, and this is a shot of the terrain around here. Beautiful mountain setting. There's a road up which we've just come to arrive here. The waiting room just as we walk in.
Such a busy man, we didn't think we'd see you.
Well, all right.
This is the lab right here.
Two of the rooms are semi-private, usually, although we sometimes have three people in this part of the room here.
These are the ward rooms.
Broke his back, paraplegic, and has all sorts of complications, including big bed sores. The fellow in the last bed there is severe diarrhea. He just came in, very severe diarrhea with dehydration. The beds would be more full, but anyway, this room is mostly malaria, I would say. Most of these patients have malaria with complications. I mean, most of our malaria we send home, treat as outpatients, but people are vomiting a lot, can't keep their medicine down, or very anemic, or having seizures, or unconscious, or something like that. Then we admit them.
The pharmacy back in here.
We get almost all our medicines from Bangkok. Bangkok. X-ray department, we have a stationary machine which we bought secondhand from another mission hospital that was scaling down to a leprosy program. We also have a mobile unit that we use sometimes in the outpatient department or in the wards if we have someone with a fracture that is in traction, can't be brought to the X-ray room. This is our, what we call the dirty room, where instruments are washed, given their first rinse, you might say, and also the surgical instruments are boiled just long enough to kill AIDS, and then later they're washed again and packaged properly and sterilized in the pressure cooker. Autoclave. Our autoclave is basically a glorified pressure cooker, sort of a giant version of a kitchen pressure cooker, and the flame underneath is just the same sort of burner that they use to make fried bananas along the sidewalks in Kanchanaburi and Bangkok. So it's low technology, easy to replace, and cheap.
And yet it does the work.
Oh, it does, yeah. Yeah, in fact, we haven't had to replace or repair the burners. They've been going for a long, long time. This is our operating room. Somebody in there now. We had an operation this morning to get out a part of a tumor, part of a uterine tumor. It was hanging down into her vagina, so we got out what we could that way. Now this afternoon we'll have to do an abdominal operation to get out the rest of it. It's a great big so-called fibroid, and but it was hanging way down inside the vagina as big as a fist. And so she's due for another operation this afternoon.
Wow, another one.
Actually, we're looking for blood, type A. Any of you
No, I'm B.
can't use
I
B?
think I made positive.
Are you really? Would you be willing? Hey, man.
Yeah, if you need it.
We sure do.
I think it'd be great. I'd give it, but I had a heart surgery back a year ago.
We better not take it from you. This is our delivery room. All of our nurses have midwifery training. They do all the normal deliveries. I don't do the normal deliveries. I just get called to the complications. I'd have burned that a long time ago if I came down to every normal delivery. All right, well,
I finally
right
got
up
your-
to the lab here, and we'll
Check your blood out.
Somebody said that we'd get asked if what
Yeah?
type of blood we had.
That's what somebody said, if you get that, they'll probably want your blood. Oh, Pat was calling us.
And here again we see the waiting room and and the outpatient clinic and everything right here. And Dr. McDaniel said this is where they have the chapel each morning, right out here, very deliberately this way. And there's Paul back there getting ready to donate some of his type A blood. They got a surgery completion this afternoon, and that he talked about. And Paul happened to have type A blood. They're going to see if it's the right kind, and if it is, we'll invest a little time in this. This is specifically the outpatient examining room. And there are some of the heroes of the outpatient examining room, a nurse. So what they crop? Process.
This larger sala or guest house is where the relatives of the patients make meals for the patients. And also where some of the less sick patients stay, patients who aren't so sick they have to stay in the ward can stay in there. And then this smaller building back here is what we call the TB sala. And that's where we keep some of our tuberculosis patients. The majority of our tuberculosis patients are treated as outpatients. But some of them come from way far away or from refugee camps which are inaccessible during the rainy season or for some other reason have to be kept close by in order to assure compliance.
Compliance is a problem, huh?
Oh yeah, yeah. Very much so with the TB patients, because a lot of them take the medicine for a couple of months and they feel well, you know, they're not coughing anymore, they're not, you know, I mean, they're eating well, they're gaining weight, they think, you know, they're cured, so they stop coming.
How many patients here?
In the salas, you mean?
Yeah.
Oh, I don't know. Right now, probably about 6 or so. The number fluctuates a bit. And then in the big sala, we probably have another 3 or 4 plus families of the patients. That's where the families of the patients make the food for the patients. We don't have a kitchen service. Relatives have to prepare the food.
If someone would give blood, well, he could do one of the greatest David Brinkley imitations. So would you say, and good night for NBC News?
And good night for NBC News.
Moment of truth. The moment of truth. Paul is about to give blood for a patient.
I can do without the you take the film, I can do without the commentary.
Meta, have Nitya stand on the other side there with Ruth, will you?
Yeah.
Yes, there's Paul's mother and his future mother-in-law consoling him as he's giving blood. And his future father-in-law is standing by watching to make sure everything goes well.
And his current father also enjoying this too.
We're supposed to have you something sweet, right?
Yeah, usually they give you a sponge ball. But apparently yours is going
How's the bag been?
Is the bag going up? Yeah, she's a nurse.
Yeah.
I'm gonna look like a junkie with all these things in my arm.
I mean, you can't get any better care than this with his mother and a nurse, future mother-in-law standing by. And his future dad-in-law standing by rooting. Go, Ray, Ray, Ray.
Laughing.
Do I get a plaque for this?
Now we come with donor number 2. This is a niece of Nitya. Say it loudly.
Moini.
Moini is her name, and she's getting ready. And Paul is telling her how much pain it will have. Right about getting 2 donors, and he set up all the pop for the whole. Drinks are on the house.
I'm going to see another patient or two. You all
Okay.
Go ahead.
Thank you very much. Thank
give
you.
your blood.
Yeah, thank you very much.
You don't need the organ donors while we're at it.
Comes the nurse with all the gory details now. Notice all the consolation that's going on there. Find a blood vessel.
Oh, do you mind?
I can take this off about now.
And there she goes. I would suggest that you put a bandage over it.
Yeah, have her put it in.
Yeah, it's trickling just a little bit.
Wrong plane.
What was that? This is my mother. And my dad's got the camera here. A little bit of water in there in about 6 scoops. Edie sat there and scolded me. There's no more over here because you drank all that.
Oh, you are?
This is the place where we stayed after we came down from Songclawberry, I guess is the way it's pronounced. It's a beautiful thing that's developed by the Highway Department, and one of the Parina Yakason girls works for the Highway Department, or I guess a niece or a nephew, and she was the one that got us this place. Right there is a room where Paul and the driver and Meta stayed, and then Ruth and I stayed over there in that door, or behind it, and there's the van in which we have been going these couple of days. Cost us 1,000 baht a day approximately. Very well worthwhile. And then you can see a beautiful setting in which this is found. If you look around at the mountains, she didn't recognize her. I don't know.
Okay.
And then the zoom is up there with your other, one way or another.
Yeah.
Yeah. For several years, island suffers the drought. Before the
Where is it? We're out by.
come up to here. Come up to here.
This is the dam.
Down about
I think this is the River Kwai, not Kwai. Kwai.
Now, the rains are coming.
This is the cliff that I scaled. Barehanded, no accessories,
They are, but
and I'm now telling you about it.
so
I climbed it all by myself,
water level
barehanded.
getting down,
Not.
down. The only problem.
This island right here would be underwater
Yes.
if it was for us.
And here are two men planning to blow up the dam, and we catch them now as they talk about it.
Okay, thank you.
Okay. I'm gonna get Gorgeous Gorge.
มันเที่ยวได้อะนะแต่ว่ามันก็ต้องได้ดูเขื่อนแล้วขอบใจ
ยิ้ม
คุณแม่รออยู่คุณแม่
อ่าฮะโอ้แต่คิดว่าเขาต้องการพรมรูปคนที่หนึ่ง
แล้วตกลงจะวนเข้าไปดูไอ้ที่ทางรถไฟโค้งมรณะอันนั้นแล้วกันนะดีจัดเดี๋ยวพี่ต้องเอาแผนที่มาให้หนู